This is Tar Heel Talk, an in-depth look at the issues and people making news in North Carolina. Here's your host, Sonia Williams.
Sleep impacts every aspect of your health and daily life. Sleeping well helps you look, feel, and perform your best, but a sleep problem can be harmful for your health and long-term well-being. Now, one of the most common sleep problems is obstructive sleep apnea. And joining me now to tell us more about this condition is Dr. Tarun Agarwal, dentist and owner of Raleigh Dental Arts. Dr. Agarwal, thank you for being here.
Thank you, Sonia, for inviting me on. It's a pleasure to be here.
Now, obstructive sleep apnea is a common sleep disorder, but it can also be a very serious sleep disorder.
Yes, it's a growing condition that's gaining prevalence and notoriety in the United States. And quite honestly, what we don't realize is, if you ask somebody if they know about diabetes, almost everybody says they understand and know about diabetes.
Right.
But what we do know is that almost as many people suffer from obstructive sleep apnea as they suffer from diabetes. In fact, it's estimated that 1 in 15 adults suffer from obstructive sleep apnea, about approximately 18 to 20 million people in the United States. And what's even more amazing is that about 80% are undiagnosed at this point.
Right.
So it's a growing condition, and it has great ramifications throughout your body.
What exactly is it?
So obstructive sleep apnea is ultimately when you create an obstruction in your airway. Typically what happens is either your soft palate or your tongue will fall down into the throat when you lay back and sleep, and that creates an obstruction. Now it can be a complete obstruction or even a partial obstruction. Some of the other things that can happen is you can have enlarged tonsils, adenoids, different things along those lines that can also create these obstructions.
And so you talk about many people being undiagnosed. I think that a lot of people will associate snoring with sleep apnea, and I know not everyone who snores has sleep apnea, but that could be a symptom.
Yeah, and typically snoring is one of the great signs of obstructive sleep apnea. And what I tell people or our patients is snoring can be a sign of a more deadly condition known as obstructive sleep apnea. And see, typically what happens with snoring is you have some type of partial obstruction. Maybe it's a uvula, the little thing that hangs in the back of your throat that may be dangling there, and you have air that's traveling through it, and because there's a partial obstruction, that air creates that flapping sound, and that creates that snoring sound that you hear so often at night.
Talk about some of the other symptoms of obstructive sleep apnea.
Well, I would say honestly, Sonia, the greatest symptom is probably that the person that suffers from sleep apnea doesn't really even understand and know that they suffer. It's usually the bed partner that suffers the most.
Right.
So oftentimes the bed partner is the one that's elbowing you at nighttime, asking you to turn over or asking you to lay on your side to really get you to stop snoring or to get you to breathe better. And really they're the ones that typically will bring somebody in or bring you to light on it. Now, in terms of health conditions, typically what we'll see is one of the highest prevalence is elevated or high blood pressure. What we're seeing is people that have high blood pressure or they're not responding to their medications. The other thing that we do know is diabetics are associated with obstructive sleep apnea. In fact, what happens is you have multiple stages of sleep. And with obstructive sleep apnea, you subconsciously wake up, and that disrupts these sleep cycles. And throughout these sleep cycles, the various sleep cycles, your body releases several different hormones. And these hormones, they're designed to regenerate. And one of the specific hormones are these what's known as the hunger hormones. And when these hunger hormones aren't released or aren't regenerated at nighttime, it creates a cycle of where you just honestly create hungerness and you create an increased appetite that you wouldn't normally have, and that's what increases our weight and increases diabetes through creating insulin intolerance.
Interesting.
It's and then also when you're sleeping and you have obstructive sleep apnea, and just imagine, if you stop breathing. Think about it this way: we can live without water, we can live without food for a certain period of time, but the one thing we can't live without is air. Okay, so imagine when you go underwater and you come up. You take that deep breath and you have your heart beats really fast, right? So just imagine at nighttime when you stop breathing or you're having labored breathing from obstructive sleep apnea, you have an increased pulse. You have cardiac events. So one of the common conditions associated or increased by obstructive sleep apnea are cardiac conditions, an increased risk of stroke, increased risk of heart attack, blood pressure, as we mentioned earlier, and the list continues to go on and on. One of the other common conditions is sexual dysfunction, erectile dysfunction, decreased libido. Many of those things are also associated with obstructive sleep apnea.
Right. And I think another symptom is that fatigue, that daytime fatigue.
Yes. Yeah, and one of the things that we often hear from people is that, well, I sleep 10 hours a night and I still feel tired. Even when I sleep 12 hours a night, I feel tired. And really what happens is you're not regenerating yourself. You're not getting into that deep sleep, that REM sleep. You're not allowing your body to really regenerate itself. And that's really what causes that.
Right. And it's important to get diagnosed and get a treatment plan in place, because to let sleep apnea or obstructive sleep apnea continue can cause some very serious health concerns.
Absolutely. In fact, one of the things that we do know is that the mortality rate, if you're a severe apneic, your mortality rate of 15 to 20 years from now is 40% greater to die than if you're not as apneic. So we want you to get diagnosed. We want to get treated. And this is one of the challenges that we face, is that for the longest time, the most common way of treating sleep apnea has been a CPAP, which is the mask that you wear, and it works great, okay? But the challenge with the CPAP is that 50 to 60% of the patients fail CPAP therapy.
Okay, what does that mean?
So they simply don't wear it.
Okay.
It's not
Right.
sexy, it's not, it's not comfortable to wear oftentimes. If you get up in the middle of the night to use the bathroom, you have to take it off. If you travel for work, for business, you have to take it with you. But it is considered the gold standard of treatment. So we do recommend people to use CPAP therapy. But if it's not working for you, or if you're claustrophobic, or if you're not able to get a seal with your CPAP, it's not doing you any good.
So what options are there in addition to the CPAP?
Okay. So ultimately, what I always tell everybody, there's several different options to treat sleep apnea. Certainly, the number one is lifestyle change, weight loss, exercise, all of those things. And honestly, no matter what treatment choice you choose, you should always include lifestyle change as part of that, okay? Number two, there is CPAP therapy. But again, like I mentioned earlier, 50 to 60% simply don't tolerate the CPAP. Then there's an oral appliance, and that, as a dentist, that's what we can help people with. Then there's also surgery as an option. And honestly, we want surgery to be the last alternative,
Right.
because surgery has a high relapse rate, and honestly, who really wants to have surgery done? But if that's what you really need to be able to breathe and get that oxygen that you need, surgery certainly should be considered.
Tell us more about the oral device, because I know you were saying that that's something that your office would be able to provide.
Yeah, absolutely. So, the analogy I like to use with people is think about this. When we are taught to save someone with CPR, one of the first things we're taught to do is lean them back and do the head tilt and chin lift method. Because when you lift the chin or the jaw, you end up increasing or opening the airway. So an oral appliance works by making a custom fitted appliance that opens your mouth and moves your jaw forward. And by opening your mouth and moving your jaw forward, it allows your tongue to posture forward, and allows you to release some of the excess tissue and everything from your airway, and creates an opening or opens your airway, allowing you to breathe better, which releases that snoring sound and obviously increases the breathing there.
And at what point would you use the CPAP or the oral device? How do you decide which is
that's
best?
Great question. So, right now the recommendations are for mild to moderate sleep apnea. They believe the first line of defense is conservative oral appliance therapy. Now, if oral appliance therapy doesn't achieve the results that we're looking for in mild to moderate cases, then we will turn to a CPAP. Now, in high, moderate to severe sleep apneics, then we want to go to CPAP therapy. Now, if CPAP therapy is not tolerated or refused, then we want to turn to an oral appliance as our backup therapy of choice.
Okay. How can people find out more information about the work that you're doing?
Sure, great. Obviously, they can reach us by calling our office, visiting our website, or reaching out to us on Facebook and social media. It's not too difficult to find us these days.
And that number is 919-870-7645. We're going to take a break. We'll talk more in just a minute. We'll be back with more on sleep apnea after these messages. Obstructive sleep apnea is a serious sleep disorder that causes a person to temporarily stop breathing while asleep. Now, this condition increases the risk of high blood pressure, diabetes, and heart disease. And with us again is Dr. Tarun Agarwal, dentist and owner of Raleigh Dental Arts. Now, before the break, we were talking a little bit about some of the symptoms of obstructive sleep apnea, but what causes this condition?
Yeah, it's a great question. So obviously, generally speaking, most of us aren't born with sleep apnea, okay? It's typically a condition that we develop over time. Now, typically, some of the things that can happen is we can have enlarged tonsils or adenoids, typically that we'll see in children or young adults.
Right.
So one of the things that we encourage people to do, especially our young adults, is we want them to have those evaluated and even surgically removed when necessary. I think what we're seeing is we want to see more and more surgical intervention for tonsils and adenoids. In fact, there's a lot of research being done about how lack of breathing in children can create growth development issues over time. Because if you're not oxygenating or if you have a decreased airway, you're not going to allow your body to grow properly. Okay. The other thing that can create that, and the most common situation, is honestly weight gain. Okay, so the analogy I like to use with people is, most of us have a garage at home. And most of the time when we buy, say for example, a 2-car garage. When we first buy that 2-car garage, we can fit 2 cars in there.
Right.
But after a year or two, how many of us can really fit 2 cars in that 2-car garage? We start to put things around it, right? So the same things happen in our airway, in our body. We start to develop, we get fat deposits. We get, as we grow older, our muscles become less toned, and our airway starts to collapse a little bit and get more obstructed. And so weight gain is honestly the most common issue. Our tongue over time gets larger, so our tongue can often also encroach into our airway and create part of that challenge as well. Some of the other issues that we can see is deviated septums in our nasal breathing, sinus issues, chronic allergies, people that are unable to breathe through the nose and start breathing through their mouth. So those are some of the issues that we can also see that cause sleep apnea.
Right. And when you talk about raising awareness,
Yes.
you mentioned what it looks like or the issues that it can cause in children. What does that look like in a child? Because a child may not necessarily be overweight. Would a child be snoring if they have sleep apnea?
Sometimes, honestly, what we're seeing, and my wife's a psychiatrist, so we see this a little bit more together. But one of the things that we're seeing is we're seeing an increased diagnosis in ADHD and ADD in our society. And certainly there's a lot of reasons for that. There's obviously our electronics and, our overall environment and things like that. But also a lot of it can be a lack of oxygenation. We're simply not getting sleep. We're not getting that rest at night times. We're more active, and we're trying to overcompensate for that lack of sleep at night. So one of the things we'll see puffiness under the eyes. We'll see, a lot of fatigue during the daytime. We'll see people that just tend to have a tendency to doze off. So those are some of the things that we'll see in kids. We'll see ADHD, depression, anxiety. So some of those are a lot of the common symptoms that we'll see in kids. We'll see mouth breathing. We'll see enlarged lips from the mouth breathing. So that's not uncommon to see in children.
Right. So at what point do you seek the expertise of a physician?
So always. So one of the things, obstructive sleep apnea has to be diagnosed by a physician. Okay, as a dentist, we cannot diagnose sleep apnea. What I look at is my job is to help create awareness. Quite honestly, most of us see our dentists more than we see our physicians. Okay, and that's unfortunate. Quite honestly, good for me, but that's unfortunate. So my job is to create awareness, to help people understand that there's options outside of CPAPs. Many people don't want to CPAP. Unfortunately, many people need a CPAP. But our job is to create awareness, help people go down the path that they need. So we work very closely in our office with physicians. The diagnosis is done by the physician. Now, one of the challenges in getting the diagnosis is that traditionally, obstructive sleep apnea diagnosis has been done by an in-lab study, where someone had to go to a sleep lab and actually sleep overnight. And honestly, nobody really wants to go sleep in a lab overnight. It's not very comfortable. It's in a foreign place. We live a very busy life. It's really hard to schedule that. But modern days, we have what's known as HSTs, or home sleep testing devices. And this is a simple device that you can wear at night in the comfort of your own home for 1 or 2 nights. And that allows us to do a great screening and a sleep test, okay? And from that, depending on the results that come back, again, read by a sleep physician, depending on what comes back, that may warrant just from that, the diagnosis of mild to moderate sleep apnea, or if the results come back, it may warrant a more comprehensive in-lab sleep test.
And I think we have a photograph of this
Yes.
in-home screening. This looks a lot less cumbersome than what you're connected with during a
Yes.
sleep study at an outside facility.
Yes, and more importantly, it's more cost-effective and economical. So, and I think one of the things that we should also touch on is sleep apnea is a medical condition, okay? And as such, it is often covered by medical insurance. Okay, so that makes it more economical and affordable for people. And we're seeing patients consistently have coverage through medical insurance for their therapy, whether that therapy is CPAP, whether that therapy is dental device, or even surgery. So we're seeing that coverage exist today.
Sleep apnea, obstructive sleep apnea, is treatable. Once you have it, though, do you have it forever, or is it something that you can, I guess, cure?
I wouldn't use the word cure necessarily, but
Okay.
you know, it's again, generally speaking, okay, sleep apnea is one of those things that's often related to weight or anatomical conditions. So if it's related to weight, obviously lifestyle change, losing weight around the neck, will take care of that, okay? So oftentimes, I'll use myself as an example. You know, when I've gained weight, my sleep apnea has gotten worse, my numbers have gotten higher. As I've lost weight, as I've exercised, as I've toned up, then my sleep apnea gets better, and we've gotten to a point where it's even gone almost away, okay? But then again, we yo-yo back up and, you know, it comes back. So lifestyle change is part of it. And our goal with either CPAP therapy or oral appliance therapy is to bring those numbers down. And I didn't actually talk about the numbers. So one of the ways we measure the severity of sleep apnea, or the way we measure severity, is what's known as the AHI, the Apnea Hypopnea Index. And what that means is that apnea is defined as stopping to breathe for 10 seconds or more. So you have to stop breathing for at least 10 seconds for that to count. And a hypopnea is defined as when your oxygen level in your blood drops 4% or more. So those combination events, take those number of events over a period of nighttime divided by the number of hours that you were recorded for in sleeping, gives you that index. And that index tells you how many times per hour you have that event. So to give you an example, just last week we had a patient who had an index of 29. So 29 times per hour they were having an event. That's every other minute. So every other minute they're either stopping breathing or they're having a decrease in their oxygen. And see, what I want people to understand is when you have that decrease in oxygen, that sends a signal to your brain. That sends a signal to your brain for you to wake up, or for your body to do something, which increases your pulse, increases your blood pressure, which disrupts your sleep. And that's really the problem with sleep apnea. It decreases oxygen and disrupts your sleep.
Okay, we're going to take another break. We'll talk more in just a minute. We'll be back with more Tar Heel Talk after these messages. Welcome back to Tar Heel Talk. I'm Sonia Williams. Today's show focuses on a common but serious sleep disorder, obstructive sleep apnea. This condition increases the risk of high blood pressure, diabetes, and heart disease. And our expert today is Dr. Tarun Agarwal, dentist and owner of Raleigh Dental Arts. I understand, Dr. Agarwal, that there is some relatively new technology used to help address obstructive sleep apnea. Tell us about that.
Yes, so again, one of the newer ways or more common ways that we're treating sleep apnea today is with the oral devices, as we talked about earlier. So, honestly, oftentimes people think about going to the dentist, they think about the goopy impressions that we use in the mouth, and honestly, nobody really likes that, okay? So the great thing today is that we can utilize digital technologies, okay? And the way we're using these digital technologies, number one, is that we can take digital impressions so we don't have to use the goop, number one,
Okay, so this is done digitally.
Digitally. So, and another thing about this is now we can take this digital image and we can actually see exactly what your airway looks like. Okay, so what that allows us to do is we can see one of the ways we can somewhat see the severity of your condition and what your airway looks like in a wakeful state, okay? Now, it's not with you sleeping, certainly, so as you lay down, things are going to be a little bit different than as you're awake. And then what we do is then we take an image afterwards in your treatment position. Okay, and then we can see that we're making a difference. So we're somewhat being able to take a look and somewhat guesstimate, are we able to make a difference with the appliance and see that, is it going to work for you? And that's one of the nice things about it. And also with this, one of the things that we're able to do is we're able to get things back faster. Okay, so with digital appliance and digital dentistry, we're able to have things fabricated much quicker. So that means we can get something for you made faster. The other thing that's nice about digital appliances is that they're made with very, very great, fast and cured materials. So they don't have the ability to trap bacteria as much. They don't smell as bad. They're harder. They're more durable. They last longer. So that makes them a lot better that way.
And if someone is maybe thinking they might have sleep apnea, what is the first step that they need to take?
Well, I think the first step they should do is they should talk to the healthcare provider, whether that's their family physician, their dentist. They should just talk to them and find out, are they a candidate, and encourage them to have a sleep test done, whether that's in lab, a home test. I encourage people to have a home test done because it's non-invasive, it's easy to do,
Right.
and it's economical for them to have done.
And you probably, with that home test, it's a lot more comfortable because you don't have to go out. And you can actually sleep.
You sleep in your home and your environment and your clothes, and it's just easy. It's interesting, Sonia. I was just thinking about. I'm sorry to go off topic.
No,
but
go right ahead.
Sleep apnea is important to me personally. Okay, I've always snored since I can remember as a teenager, and it got to a point when I got married. Before I got married, I didn't have a bed partner.
Right.
So my snoring didn't bother me. Okay, I didn't wake up myself, it didn't bother me, but I always noticed I was tired. I just thought that was normal. Hey, I'm a college student, I'm staying out a little bit later, I'm not getting that rest, I'm tired. But then when I got married, I had a bed partner, right? And that bed partner started feeling the effects of it. And she forced me to go get a sleep test done.
Which is usually how it happens, or how it works.
I would say that more than 50% of our cases that we're treating are the bed partner forcing the person to come in.
Right.
And get something done. And so my wife forced me to go get a sleep test done. And what I found out was that, wow, I'm a severe sleep apneic. Okay, and then I went through CPAP therapy, and I felt great. I felt high energy. I felt like, wow, this is unbelievable. This is a big difference. I had a pep in my step again. I felt really good. I had energy. I was there for my kids. I felt great. And then the challenge comes is with the CPAP, you have to wear it every day.
Right.
Okay, and most men aren't the best at being consistent about things. And I fell into that situation. And all it took was one night I forgot, and then the next night you forget, and before you know it, you're not wearing it anymore. And then you go down that path where you're not wearing it anymore, and essentially you're not treating the condition you have. And I started snoring again, I started being tired, and I started, honestly, I'll admit it on air, you start sleeping in separate rooms, okay? Because nobody wants to sleep with somebody that's snoring, and everybody wants to have a restful night of sleep,
Right,
okay?
right.
And so ultimately I went to an oral appliance because I wanted to sleep in the same room together, right? And what I saw with the oral appliance is that it brought that back together again. I was sleeping well, I stopped snoring, I felt great again. And honestly, once I felt that for myself, I said, I have to bring this to my patients as well. So I tell people, CPAP often is the first line of defense and the choice, but if you fail CPAP or if you're not willing to wear a CPAP, oral appliance therapy does exist. And one of the things that I want to encourage people or to look at when they talk to the dentist, are they trained? How are they doing this? Are they making the appliances? Are they doing follow-up treatment? Are they doing what we call titrations? Are they making sure it's effective? We're doing follow-up sleep studies either through our office or with the physician. Our preference is to work directly with the physician to make sure that our appliance therapy is effective. Because the last thing I want to do is make an appliance for somebody and have it not work.
Absolutely.
So we want to make sure that it's working.
Excellent guidance. I want to tell people how they can find out more information.
Yes.
They can go to Raleigh Dental Arts at 919-870-7645. 888-888-8845 or dra@RaleighDentalArts.com. Dr. Agarwal, thank you so much for all the excellent advice, and thank you for being with us today.
Thank you, Sonia. It was a pleasure.
All right. That's it for this week's Tar Heel Talk. To comment on this or other episodes of the show, follow us on Facebook or Instagram. Thanks so much for watching. I'm Sonia Williams. Enjoy your week.